Hi, Sally Ann here, and today's episode is part of Ovarian Cancer Awareness Month in Australia. And we're going to have an important conversation about how nutrition, lifestyle medicine, and compassionate support can play a role alongside medical care for women navigating the cancer and also those supporting them. And to help guide this conversation today, I'm very pleased to welcome back Jane Freeman to the podcast. Welcome, Jane.
Thanks, Sally Ann. Thanks for having me. I'm really looking forward to this. A dietitian who does work with people who predominantly are living with and beyond cancer, and certainly specializing in oncology nutrition. I see every day how nutrition can dramatically kind of affect how people not only tolerate their treatment, recover, and just how they feel in themselves. So yeah, I'm really pleased to be, kind of helping spread that word with you today.
Yes, and I do want to give a little bit of your background, but just because you have mentioned that, I want to say that there is so much misinformation out there, and I want to touch on that with you today as well, because, cancer of any sort can make us feel very vulnerable. And it is one of my passions, obviously, to make sure the information that I'm sharing on this podcast is evidence based and can connect people with practitioners who actually have the training and the expertise. So I'm really pleased just to share a little bit of your background before we get underway. Jane is a highly experienced cancer dietitian and nutritionist. She's board certified in lifestyle medicine, an award-winning author in the topic of cancer, an international committee qualified sports dietitian, and she consults here in Sydney at Mater Hospital Wellbeing Centre for cancer patients, Valiant Health, and
Lifestyle
Alia.
medicine. It's a hard one, that one.
In addition, Jane does provide telehealth consultations. And Jane last joined us for Breast Cancer Awareness Month. And so I'm just really pleased that we're able to continue this vital discussion around nutrition care for people with cancer. So, Jane, tell us a little bit more about ovarian cancer and how might a woman know that she actually has the cancer before, consulting with her doctor?
Yeah, okay. So, ovarian cancer, of course, is a cancer that typically begins in your ovaries, the fallopian tubes, or in the lining, epithelial lining of your abdomen. And these tissues are quite closely connected, so that's why they're often grouped together. There's 5 types, probably 3 main types that I'll mention. So one known, which is the most common, high-grade cirrhosis carcinoma, and I guess that's because it begins in the cirrhosis membrane of actually the fallopian tubes. There's a low-grade version of that and an endometrioid carcinoma. Now, I think the important thing, here is all these do behave differently and, of course, respond to different treatments. One of I suppose, the challenges with ovarian cancer is it's the one that's often picked up a bit further down the track, and that is because symptoms are often subtle and quite easy to dismiss. Things that many women suffer from, bloating, some abdominal or pelvic pain, might feel a bit full, appetite might be a bit up and down, bowel habits might be changing, but again, people might just think that's a bit of irritable bowel syndrome, obviously fatigue, unwanted changes. So I think the key takeout there is that if you are female, of course, and you're getting more, symptoms are a bit more persistent, and you're doing different things, but they're still sort of hanging around, or things just feel a bit unusual most days, then I really emphasize a need, for sort of going and talking to your GP. And diagnosis is normally done by ultrasound or CT. They can just do a simple blood test, which screens, a CA125, which is just something that they can easily do and read in a blood test, and changes in that particular enzyme will show, perhaps a risk or indicate further need to investigate for ovarian cancer. There's no reliable population screening or anything else at this point in time. So it does really rely on women tuning into their bodies, just being, noticing if things just don't feel right or are persistently causing them some grief. So, yeah.
Thanks for sharing that, Jane, because I know when I was preparing for today's conversation, I felt the same when I was looking at the symptoms for ovarian cancer. I thought, oh my goodness, these are just, so common, and we could think that it was gut related. We may even think it was related to going through perimenopause, some of the
Right, yeah,
symptoms.
period pain or whatever. Yes, lots of things. Yeah.
Yeah, so I think likewise, I just encourage all women to learn what their bodies feel
Mm.
like when you're well, but also just start to notice when things are not feeling quite right, and that being tired, for example, which is a common one for a lot of the women that I work with, um, it may be because we're burning the candle at both ends or we're stressed about something, but there could also be something physical happening to us as well. So I think I would just encourage you, to talk to your healthcare practitioners as well
Mm.
about that.
Mm.
And Jane, when it comes to risk factors for actually getting ovarian cancer, what are the sort of common risk factors that we know about this cancer?
Yeah, increased age, family history. We've got the BRCA gene mutations can also play a part. Many women suffer with endometritis, which is a very painful, difficult condition to treat. That's a risk factor. And just general hormonal things, early menstruation or even late menopause, can certainly be risk factor. Health in general, physical activity, a healthy weight, healthy diet, and alcohol can also just play into helping mitigate your risk factors for cancer, like ovarian cancer. And sadly, just under 2,000 women are diagnosed with ovarian cancer every year, but unfortunately, it has got the lowest prognosis rate of any female cancer. And partly, as you're just saying, it's like due to late detection because again, we often just dismiss these kind of symptoms that we've just kind of explained as just part of being female and kind of soldiering on and getting on with it and yes, so really again you really make the point that it's so important to talk to your healthcare practitioner if things just start feeling quite right.
I think it really is important, and emphasizing what I like to call that you time for women every day, even
Mm.
if it's just carving out 15 minutes twice a day where you can actually just sit and check in with yourself. And I have had the opportunity to visit Ayurvedic centers in India
Mm.
a few times, and they place a lot of emphasis on us being the experts in our bodies. How does your body actually feel? How does your mind feel?
Mm.
And, part of that ritual of waking up in the morning, hopefully it's not to an alarm blaring in our ear. But if we do just wake up naturally, just sort of checking in, how am I feeling today? How's my body feeling? Am I feeling anxious? Am I feeling calm? Do I feel rested? And just making that a bit of a practice, I think, is a nice way to check in with ourselves without becoming too vigilant or too
Yeah,
stressed about how we're feeling as well.
exactly. Yeah, so important,
Yeah.
especially in this area. Yeah.
Yeah. So, what can we do from a lifestyle perspective and also a food and nutrition's perspective to reduce our risk of developing ovarian cancer?
Yeah. Well, I think the evidence would tell us, Eliane, that, single food per se can prevent ovarian cancer. And I think that's really important because people do get really hooked up on sugar or other things. But I guess what we're looking at is more of a overall healthy lifestyle, healthy dietary approach. I'll explain kind of what I mean by that. But of course, just doing your best to make some time for some activity. Like you said, that can be part of some me time, a lovely walk, getting some blue-green space is always a good time to reflect and just check in with yourself. Doing your best to maintain your healthy weight, just again, eating well, feeling good about your body, of course, is really key. Alcohol is one, we really do know is a toxin to the body, can affect your cells and how they divide. So certainly just watching intakes of alcohol is something we can do. When it comes to a diet, I guess the evidence is really moving us more towards eating a diet that we kind of call plant-based or plant-forward, which is really centering our food intake around trying to meet our at least 5 serves, 5 cups of vegetables a day. And within that veggie group, it is trying to get as many different colours and green leafies, the cruciferous vegetables, which we also know are really protective, mushrooms, red carrots, beta carotene. So just as much colour. And, we can do that. Like, again, it's really hard, I know, to think about that, but, convenience is helpful there. So frozen veg or canned veg, or certainly grabbing salad bags if that helps you out to get a salad on the table with your meal. A bit of fruit. It's a nice time of the year for fruit because all the lovely stone fruit's in season. So really go out and indulge in some of that. Grains, people get really confused about carb and should cut carb, but of course we're trying to reduce the processed refined carbs, but instead we're looking at whole grains, soy and linseed type sourdough breads, quinoa, brown rice, also legumes, lentils, chickpeas. They're really great foods, really high in protein. And all these foods also have this group called phytonutrients, which actually use the word phyto because they are extra nutrients in these foods that do get in and help protect our cell health and are anti-inflammatory. And some important nuts and seeds. So I think it's thinking about that plate, half your plates, ideally, with vegetables. A quarter is kind of really some grain-rich kind of carbs, high fiber. We know that's so important for gut health, which again is another whole topic, but again, really integral into health and also how we might respond to cancer treatments. And then I'll talk a bit about protein as well. But again, trying to get more proteins from trying something like tofu, which I know a lot of people turn their nose up at, but, put it in an air fryer with a splash of soy. It actually gets quite crunchy and it goes really well in a stir fry or to a salad and whatnot. So so just kind of really leaning into, more whole food plant foods is definitely from a nutrition's perspective where we encourage people to take their diet if they can. And of course, just kind of Australians get over 50% of our calories. We know that from really ultra processed food, sugary drinks. So again, we know those foods do promote inflammation, problems with our insulin sensitivity and hormone balance. So again, just really trying to instead fill up a whole grain brekkie, and something like simple, like a good whole grain sandwich or salad in it, put some baked beans on it or something. Just try and really be proactive at filling up on good food, because that will really displace your appetite in most cases for the sugary drinks and the unhelpful snacks. So I know that's a lot to digest in one big chunk there, but hopefully some elements are getting through there.
Yeah, and I think it's really important. And I was reading a couple of things related to what you've been sharing, just about general health and especially gut health and our metabolic health and reducing that chronic inflammation. And I heard chronic inflammation recently described as a fire that's just burning away in our body. And I thought that was a really good visual, because I know when I talk to my clients, often it is hard to understand what this chronic inflammation is. We understand when we sprain our ankle, we get some inflammation and some swelling. It's very visual and then it goes.
Yeah, well, that's a good type of inflammation. But yes, as you're saying, low-grade chronic inflammation is the one that is
That's right.
concerning. Yeah.
Yeah, so I think, and the other thing too that might be helpful from that visual perspective, when we say look at the Mediterranean style diet, which we know has many health benefits, they talk about that being 80% plant-based and 20% perhaps coming from our animal foods, and very little, if any, red meat.
Yeah, exactly.
Quite a big change for Australians. There's no doubt about that. So, Jane, tell us a little bit more about the nutrition, seeing we've started on this now. I know you had some more information about protein and so forth you wanted to share.
Yeah. Well, I think it's, I think what's also really useful just to clarify for our listeners is that when we talk about general healthy eating, preventative eating, you're right, we're really talking plant forward, plant-based, more Mediterranean. But I guess for women who are actually undergoing treatment for ovarian cancer, things can be a little more difficult or challenging. And that's because there are often some difficult side effects from treatment. From common treatments used will be surgery or chemotherapy or targeted therapies and sometimes immunotherapy. And they all have their unique set of challenges, and then all the drugs they use around that to help you cope with those things, the steroids, etc., anti-nausea medications, again, they can also play a little bit of havoc on just our digestive tract, how we feel. So I think it's just really important to just clarify that general healthy eating is our first go-to when all is good and we're feeling well, and that's what we really encourage to start with. But yes, of course, there can be some appetite, taste changes, bowel function changes, nausea, fatigue, intentional weight changes, and all those things will really affect how you feel, your quality of life, but also how well you might respond to your treatments and whatnot. So I thought of just helping frame that as a way that helps people guide on some practical nutrition support that they can kind of use just to help navigate that space. And before I jump into that, this really aligns with the World Cancer Day, which was last week theme, which is all around being unique. And the theme is united by unique. And the point being is that it's not about a disease, it's about a person and their unique experience and challenges and side effects. And it's really calling on us as health professionals and just look at people as individuals, not because they've got this type of cancer or that kind of cancer, and really listen to them and learn what they're going through, and therefore, of course, really tailor care. And we really aim to do that with nutrition. So this framework I'm sharing is a framework, but again, really emphasizing that every person I see, I know they're unique. I know they're having their own set of challenges. And when it comes to their diet, I always say everybody has a different diet. No person eats the same, has the same relationship with food, cultural experience, etc. So it's really important we understand all of those layers as well when we're sort of supporting people, ladies who are having side effects. So anyway, my little monique is TEAL CARE. And teal happens to be my favorite color as well. I love that really green color. And of course, it is the Ovarian cancer ribbon color. So that's why I sort of thought that would stick. I think it's like what we were saying. The first T is about just taking charge of your nutrition and really checking in. And I think that really speaks to what we were saying just about also those, troubling side effects or symptoms that might be suggesting there's a risk of ovarian cancer. Nutrition is kind of one of the few things you can really take charge of when you're going through treatment. Often, of course, with the other medications and other things that your doctors will be sort of guiding you on, recommending are things that, you can't really decide on. You're going to decide on your dose of chemo, etc. You obviously trust a specialist to guide you on that. But you do know what you feel like eating. You know, like what feels manageable. Maybe thinking about what time of the day works best for you. Like really take charge and think about nutrition and how it can best work for you. There's no fixed rules on this. For some people, they feel a lot better in the morning. So maybe having more of your main meal or more of your nutrition early in the day would work for you versus traditional dinner time meal, for example. Sometimes just nibbling or grazing will work better for you. So it's just really thinking about, I'm in charge here. I'm going to set my own rules. Of course, I'm thinking about what I need, and I'll talk a little bit about what's going to help support, but do it your way, I think is and that's the key message, and that's okay.
Yes, and as you were talking, Jane, I thought, oh, this is so aligned with mindful eating in many ways as well, because I do work with women that have health conditions, not so much in the cancer area, but it's relearning what your body needs at any moment in time. So that's really lovely. And I think too, with the guidance of someone like yourself, then a woman can take charge and actually feel confident that she's nourishing herself in the way that her body needs at that particular time.
And that checking in is also, okay, if things aren't quite right, I'm noticing some shape or weight changes, I'm having some difficult side effects, that are really impacting on my ability to eat well, that's what you need. Your doctors are very good at asking all these other questions, but sometimes we also have to remind them that we're struggling a little bit with our nutrition, and then again, putting your hand up to get some more tailored specialist advice around some of the challenges that, sometimes again, it's just this idea of women just stoic creatures that just have to grin and bear everything. But I think it's just really important. If things are not right with your diet, it's a basic need, it's a fuel, it's everything that's going to help you feel better. So if it's not feeling right, you're noticing you're struggling, check in really take charge and talk to your healthcare professionals. I think that's the most important one.
Yeah.
The second E is again, just knowing there can be a whole lot of, I kind of call it my nursery food diet. You can have some sore mouth, some ulcers, taste changes, just feel a bit off, etc. So we find those fork foods, soft, moist, easy textures are good to go to. Easy foods, something that I'd really suggest. And again, this stands alongside the ideal diet. Sometimes just eating anything or just kind of go-to foods are fine. And that's what your body's telling you, a bit like I'm saying, mindful, being tuned in, what you need, what you feel like, listen to your body. So smoothies, yogurt, soups, some scrambled egg or tofu, custards, that kind of thing, all high protein foods, easy to eat, and definitely can be something you can kind of include, again, just to help with dealing with challenging times.
Yeah.
The A stands for adequate protein. We all kind of know protein's important for maintaining muscle mass, supporting our immune system. But I think it's also remembering that there's so many sources of protein, not just from meat. So it's looking to sort of plant-based options, tofu, tempeh, soy yogurt, soy milks, or other plant milks, Greek yogurt, nut butters. Also, people don't realize that a slice of really whole grain sourdough bread has to 10 grams of protein in a couple of slices.
Yeah.
Quinoa, some of the pastas have nearly 20 grams of protein in them per 100 grams. So we often just sort of think that, it's just about eating more meat, but in fact, there's many foods. And those other foods have the benefit of having fibre and other key food nutrients in it that would also need help with inflammation, reduce inflammation, gut health, etc. So focus on protein. It's best to try and dose it as much as you can across a day. We don't really store protein, but just that little and often, nut butter on a crack, a handful of nuts, a bit of hummus, all those kind of little foods you can just nibble and sip on across the day, just to keep your body working with enough protein. It's important.
Yeah.
Okay.
Yeah, and I think that's really good because in this situation, we're probably not worried about satiety so much, but we're worried about quantities eaten throughout the day that are manageable and digestible and you feel comfortable after eating. Obviously, protein does provide that satiety benefit, but if you're starting from a position of perhaps feeling a bit nauseous or a bit uncomfortable, then that's not so much of a concern. But same message, isn't it? Which is good. It's consistent, which is helpful for people listening. Yeah.
Absolutely. And doing it your way. Hydration and fluids are a really important one. Again, there can be a lot of challenges, bowel function challenges. We'll talk a little bit more about in a second, about fibre. But we always say, look at your urine colour. But quite often when you're having treatment, you've had drugs and maybe iron infusions or other things going on, your urine colour isn't often the right guide. When you're on lots of drugs, it can look pretty brown or murky because of the drug. So it's just really important to definitely keep on top of your fluid. It can be, of course, water, but other fluids count. Obviously, milks count. Fruit can count with high in lots of water in it. If you're having some taste changes, of course, you may need to flavour the water. Typically lime, lemon, mint flavours can feel refreshing. But just kind of, sometimes it's good just to maybe fill up a water bottle or something, just because, again, when you're just feeling a bit poorly or whatever, it's hard. Sometimes it's just hard to bring yourself to drink. And it's just good to sort of keep a little gauge on how much fluid you are managing to get down, particularly if you're not feeling great. Small sips, just try and drip it in is kind of what we've encouraged there.
Yeah, that makes sense. And again, spreading it out in between meals would be helpful as well. So you're not overloading your stomach at any one time. So yeah, that consistent sipping. But I know myself, Jane, I have to keep a water bottle. It's the best way for me to track how much I'm drinking in the day as well.
Exactly, at work and whatnot, when you're you're busy at work, and unless you really set that water bottle front and center, it can be very easy to forget to drink. And it's really important, but especially keeping hydrated. Treatment is really important, so it really help how you feel and supporting our function.
Yeah.
I mean, this is kind of really relating a little bit to what we've already talked about, but I think there's a lot of pressure to be eating a perfect diet or eating all the right things and cutting this out and restricting this. And again, I just want to say my A is just that anything is better than nothing. Let's remove that pressure that is often put on people to sort of comply with recommendations. As I really alluded to, I often talk to people about, okay, you can have your green energy salad option, but quite often you might just need mum's homemade chicken soup. And I think it's just really appreciating that there are times when we've just got to listen to our bodies. And again, we're really sort of making that point that you've just got to do your best. But I think really sort of with nausea and those kind of challenges, really important not to have long gaps between eating, like actually having a cracker to nibble on or something. I often get people to put a cracker next to the bedside if they're waking up. Often we wake up with nausea, and it's we're waking up on an empty stomach, and the acid in the stomach makes that worse. So nibbling on a cracker even before you get out of bed can be something that can just help with sort of that kind of those kind of struggles with feeling a bit unwell and nauseous. But just again, listening, taking the pressure off, doing what feels right for you, and really sharing that with your family. Because I often see it's the family that put pressure on their loved ones to do the right thing, to cut out this, to do that. And again, it's all well intended, but it can often add more stress and angst to what's already a difficult time.
Yes. Yeah, no, thanks for sharing that, because I think it is only natural families are going to want so-called the best for their loved ones. But again, coming back to the practice of mindful eating, only you know your body and only you know the best way to eat for you. It's a message, I think, in all situations we need to empower women with, and men as well, to say, well, actually, I'm in my body. I know what my body needs. And again, with the right support from trained practitioners, they can get the guidance to maximise what they need as well.
Yeah. So I guess because ovarian cancer is near the bowel, so a lot of the treatments also really affect bowel function. You often see both ends of the spectrum going through treatment will often really struggle with constipation, even though they may have had normal bowel function all their life. Just some of the drugs really slow the motility of the gut down and making the bowels very difficult. On the other hand, some of the treatments really affect the gut lining. Sometimes people almost be a bit like sunburn inside. So they'll often struggle with really lots of diarrhea, bowel discomfort. So I guess this is where you have to walk that little bit of tightrope line with fibre. So on the hand, we of course want the goodness from the fruits and vegetables and whole grain cereals that we really emphasise. Oats, chia, psyllium, etc. And definitely including more of those foods in your diet, or as best as you can tolerate. Got to be a little bit careful. Often I'll say to people, fibre up. The last thing I want them to do is start eating boxes of all brand, because that will just really blow up their bowel. And gut's very sensitive with ovarian cancer, because as I said, it's very close by to where these treatments are being targeted to. So basically, you are definitely trying to build up your fibre if you are, and fluid if you are struggling to open your bowels. But of course, if you're having on the other side, it might be suited to just reduce your intake of fibre. Maybe just, as I said, that more simple diet, a bit of white rice, things like, maybe banana, what we call more of the soluble fibre. So some stewed fruit or something like that would be preferable for diarrhea. But again, the important message here is if you are struggling with those kind of bowel function difficulties, it really can drain your day, and the gut's so important. And again, it's just something people just sort of, okay. I hear people not leaving the house for days because they're struggling with diarrhea, and they're scared because they're not sure they can find a toilet if they go and meet with a friend. So again, this is something that can be managed either through diet or with some support of other medications. So really, again, emphasise to talk through those kind of challenges with your healthcare professionals. Don't suffer in silence.
Yeah.
If the doctors or nurses or anyone recommends that you might take something, again, a lot of people feel really anxious. I'm taking so many medications already. I don't want to maybe take the gastrostop or Imodium because I'm taking too many, but instead I'm going to sit home for days next to the toilet. Within reason, encourage people just to use those medications that can help these sort of side effects. We want you to get out and really enjoy every day as best you can around this time. So
Yes. And again, what we know from the research, but our own experience, that socialization and the connections with family and friends is really important. It is so important for our health and well-being. And obviously it's important at this time to reach out to those that are supporting you and make you feel warm and loved and energized as you're going through these treatments. It's quite important.
We all know how good it can be just to go and meet a friend for a coffee, and maybe you might just, it's a birthday and you share a slice of cake or something. You know, the mental health benefits, joy you get from that experience is going to far outweigh any detriment effect with a few bites of a cake or something like that on any given day. So it's
Yeah,
not your
but
normal everyday thing. It's just about recognizing that, you know, sometimes.
yes. But as you were saying earlier too, just in terms of general well-being, but going to a park or a garden, or you live by the ocean, all of those things are really sources of nourishment as well. If you like art, go to an art gallery with your friend and enjoy that experience. Again, it's all going to help with how you're feeling
Yeah.
in your
And
mind and
as
body.
I said before, anything is better than nothing. So it's just trying to get out and do something small. You know, a small walk is always going to, you know, feed the soul. So I guess, and when you feel really wiped out or you're lying on the couch and, you know, just trying to do something, anything is better than nothing, because it will help.
Jane, thanks for sharing that. Maybe we could just recap on the TEAL care at this stage. I know you mentioned that you're happy to share that as a handout, which I'll make sure goes with the episodes. But could we just run through those letters again for people, just briefly?
Yeah, we just got the last E there that we've got to get in.
Okay.
So I think the last E is joy as best you can. I too. Again, there's a lot of angst around what we should eat around when we're in treatment for cancer and whatnot. So I think, again, it's just within broad guidelines, really being proactive in a good, positive way to approach the diet, but recognizing things sometimes have to change or be modified to, again, optimize how you feel and how you're coping with your treatments. So it's just really sort of positive and joy. Take food as what it's meant to do, nourishes you and your soul and your body and mind is really my kind of key takeout.
Yeah.
Yeah, so I guess, yeah, just going back, you know, T is just taking charge, checking in, you know, being really listening to your body. E is finding things that work for you, might be easy eat foods, softer textures. Sometimes we can't tolerate cold foods, you know, spicy foods, whatever. Just again, the foods that are easy for you to eat. A is adequate protein. We know how important that is, you know, again, supporting us through treatment. Liquids, L for liquids and hydration, keeping your fluids up, water bottle or a glass of water with a straw or something. You know, C is just, again, sometimes with the taste changes, I miss this one, it might be just finding a flavour that works for you. I said coffee can count. For some people, you know, those often recommended those quite sweet nutrition supplement drinks, which if you've ever had them, they're pretty syrupy and difficult to take. So but sometimes that coffee flavor can be a little bit of a dull flavor or a flavor that just sells the sweetness. So that could be something you might want to try if you're really struggling to get enough nutrition in. You can put it into your sausage and shake or whatever your frappe. It can work. Anything is better than nothing, and that applies to food, but also, as we were just saying, just getting out and doing what you can on the activity front is really important. Managing fibre, depending on what the bowels are doing, which way they're swinging. And then, as I said, the most important one is positive, enjoy, nourish, do your best. But diet's not something that's meant to be perfect. It's not something that's going to cure the cancer per se. It's going to support, it's going to nourish you, it's going to carry you through. And that's what we want you to set the context we want.
Jane, thanks for running back through that because I think it really is a nice summary. In many ways, it's a journey with food, but it's a journey with yourself and those around you as well in terms of those considerations that you're making with the TEAL care. So, Jane, is there anything else that you'd like to mention about women who may have ovarian cancer or how we best support women who are going through this journey?
I love that Our Cancer Day motto, which is just all about recognizing that it's all about just unique and tailored and supportive care. There's many bends in the road through treatment with ovarian cancer and obviously many sort of challenges and side effects. And I think what's important is that we're flexible with nutrition, as we really emphasize. It's taking charge, it's listening to your body. If things are not quite right, if you're feeling really fatigued, you're noticing kind of your belts are a bit loose, so you know, when you're losing weight without trying, or you feel really uncomfortable because you're feeling really bloated, all those symptoms, I guess, you know, should be discussed with your healthcare professionals, your doctor, and they can obviously ask or recommend that you talk to an oncology dietitian who, you know, is really well placed to just sit down with you as an individual and understand what's working well for you at the moment. And then I always say I can add some tweaks or some suggestions that just might help you to manage to cope. Might be something like just helping you learn how to best get a lunchbox set up in the day, so you can put a few snacks in that box and just keep it there ready to, you know, make it easy to grab a few nibbles, you know, if it is feeling really hard to make a bigger meal or whatever. So as I said, it's more about just recognizing every person with cancer will have a very different experience, and it's really important we understand those individual needs as such. Yeah.
And what about for loved ones? Any sort of just gentle guidance that you can give them, especially when it comes to the food? And we mentioned earlier, it's very tempting when you're seeing someone you love go through a challenging journey to want to try and help. But how do we help in the best way?
I think that's a really good question. And quite often I sit in a consulting room and I've got mum who's dealing with something, you know, the ovarian cancer, and of course you've got the daughter and the son-in-law and so and the auntie there, and there's really read this on the internet that they should follow this sort of diet, and they're really putting a lot of pressure on mum to do these things. So I think it's just really important for loved ones to just, I guess, maybe sometimes you are there to support, to help, but let the person who's going through the experience of being treated for this cancer really guide you and sort of help really understand how you can best support. So it could be like, as I said, sometimes it might be about having your main meal earlier in the day, because that's a better time for your loved one. Feels a bit better in the morning, more energy in the morning. Later in the day is really, really fatigued. So nighttime they just want something really light and easy, and you know, a soup or a small pasta dish. Whereas you might go out for breakfast and have a nice brunch and make breakfast just in there, for example, because that's the time they do better. Might be helping them get a lunchbox of snacks or getting some easy food in the fridge. It also might be talking to the friends or the support crew who are making meals to maybe just, you know, give them a bit more guidance on what your loved one, your mum or your sister or your aunt or whatever's really feeling like at the moment. You all know as much as they're great, good foods, but you know, people get lots of lasagnas and banana breads and whatnot. So I always encourage people to say, look, even give a recipe, you know, this is my favorite soup, or I really like this risotto. That would be really great if you could maybe, yeah, make this for me. You know, this is what I'm really feeling like today. And that might change. Things do really change. Our relationship with food, our taste, as I said, changes. There's lots of things that can really affect what we feel like and want to eat on a particular day, particular week. Obviously, closer to the time when we've had our chemotherapy infusions, it's a bit harder. So I think it's just recognizing how challenging it is for that individual when it comes to food choices, and just sort of being really guided by them. It's okay to sort of gently nudge and encourage, but just so that line of when it becomes nagging, putting pressure, and really making it a stressful sort of time at the dinner table. And there might be times where your loved one just doesn't feel like eating, and that's also okay, but don't make the dinner tables a place of angst. Make it a time to catch up, discuss the news of the day, feel good as well, because it's about that as well.
Yeah. And you did mention in there that it's only natural loved ones are going to do some reading. And I know when we did the Breast Cancer Awareness Month episode, we talked about the actual dangers and harm of supplements rather than excessive supplements being supportive for cancer treatment, and also the restriction of food groups, because when we really look at these extreme diets, that's what it is. It's cutting carbs or sugar, which we've talked about. But is there anything else that you'd like to mention about extreme restriction of food groups or supplements, Jane?
Yeah, well, I think again, going back to that place of that healthy plate we've talked about, balanced diet, Mediterranean diet, there is a reason we have these dietary guidelines, and that there are food groups, and we know these different clusters of foods, grains, your dairy or dairy alternates, your protein foods. They provide really key nutrients for our bodies to function, recover. Obviously, you know, our body going through cancer treatments under a lot more metabolic stress. So we really need to make sure the diet is well balanced and includes quality range of foods that providing these key nutrients for our body to work and function. And, you know, people forget too, before you even get out of bed in the morning, you've burnt sort of like, I don't know, maybe 1,300, 1,400 calories just from food we eat is keeping our body working, it's recovering, so it's our brain, it's all those sort of things. So if we start to go down that track of restricting key food groups, we're cutting out key food nutrients that are critical, especially critical at this time for a person who's really needing to pull on all stalls and to really respond to these treatments, recover, be ready to be able to cope with their next chemo. Chemo really sort of affects your blood counts, and then your body's really got to recover from that. And it takes a lot of extra protein, energy, and nutrients in order for it to do that. And if you're restricting, it may just mean then your body's not going to recover, and you're not going to be able to cope with your next dose of chemo, or the chemo dose may be needing to be reduced. So I think it's just really important to remember that that window of time during treatment, we really need full on really good quality, high octane fuel to be the priority in the diet to enable the person to have energy, strength, and ability to recover.
Yes. And I think the whole supplement story in general, let alone with someone with cancer, the body doesn't work that way. You know, that's why we have these foods. The body extracts what it needs from the food.
Yeah.
Whereas if we're overdosing with certain nutrients, then we're not absorbing other nutrients. And I think that's what people don't realize, that there's competitive absorption of nutrients. So again, we're just making it harder for the body. And I think you mentioned in our previous discussion on breast cancer that these vitamins could actually be food for the cancer cells, which we don't want either.
Right, that's right. A nice sort of analogy, I like to think of it as a symphony orchestra. Every little instrument has its little place. You don't want the trombone bleating out, you know, because you've overdosed on the trombone, because it's not going to be an enjoyable show. So I think it's just important to appreciate our body is very fine-tuned. It knows how to extract the key nutrients it needs from diet. Now, of course, if there are challenges because of low appetite or not eating well, then we're able to have a look at bloods and assess if in fact there are some nutrients that might be a bit lower than ideal. And then we again tailor and suggest what's needed in appropriate amounts. We're not mega dosing or again, displacing other key nutrients that are equally as important.
No, that's right. Thanks for that, Jane. Is there anything you'd like to say before we start wrapping up?
I just think I'm just sort of plugging my profession. I think that our group of oncology dietitians that were around Australia in hospitals and cancer clinics and in private practice, we guess we're just really a resource. We do have lots of tips and tricks. I've learned lots of tips and tricks over my many years just working with individuals who share me what works. And I guess we're just really happy to sit down with you and just really help tailor and give you some good evidence-based latest. We spend our times reading the journals. We're really up to date. We just really able to translate that and help you cut through the confusion and the angst and sometimes the unnecessary pressure or stress on what you're doing with your diet. And so really just reach out to us. We're really eager to support you in whichever way we can.
Thanks for sharing that. And Jane, where's the best place for people to reach out for you if they've got some questions or may want to organise a consult? How do our listeners go about that?
Well, I can share my contact details. As I said, I'm working at a couple of different centres in Sydney, and also now with the advent of telehealth, that means it's great. Telehealth is such a help for people who are going through treatment for cancer. They have often so many appointments, and it takes a whole day to go, and they're feeling fatigued to go to the hospital and see the dietitian. So it's so great that they can just log on at home in the comfort of their home, and it's really works well with nutrition. So they can reach me through my website, cannutrition.com.au, which I'm just updating at the moment, and I'm going to change it to cancerdietitian.com.au. But at the moment, it's Can Nutrition. I found no one really understood what Can Nutrition was. It was about cancer, Can Nutrition. But
and also, you spoke about that as well, that Can Nutrition means that it is doable as well. We can do this. So
you can take charge with some support and guidance. That's really what I would hope as well. But nevertheless, that's where you can find me. But also just in your own centres and clinics, usually there is a dietitian who is attached, and to your nurses or doctors, they'll normally be able to recommend someone they know they know is a trusted and experienced oncology dietitian.
Thanks again, Jane, for joining us today. Such a a valuable discussion that we've had to help people navigate, ovarian cancer, but cancer in general, because many of the struggles would be similar for people with food and nutrition, and especially cutting through all that misinformation about nutrition. So thanks for sharing your time with us today.
Thank you so much for having me, Sally.
And I'll make sure Jane's contact details are provided with this episode's notes, and also the TEAL CARE checklist that Jane was talking about during our conversation. And if you've enjoyed this episode, please let us know. And if there's a friend that you feel that would benefit from our conversation, please share it with them. This brings us to an end of this series of the Eating for You podcast. I'm taking a few weeks and then we'll be back with series 7. Until then, take care, and I look forward to sharing with you again soon.